If you look at trends around the world, whether it is in the US, most developed countries, or emerging markets, the demand for healthcare is massively outstripping the supply. And at least in my lifetime, I don't see us training enough healthcare workers, doctors, or nurses to address that demand. So we need to figure out a way to not just tell patients, this is what you should do because we don't have the resources to do that, but can we empower them to start taking charge of their own health? My name is Aakash Ganju. I'm based in India. About 5 years back, we set up a social enterprise called Saathealth. Our main focus is to reach low and middle income families across India. How can we inform them, educate them, and how can we meaningfully allow them to make better health-seeking choices? If you look at India, it's a huge country. Everybody knows that. We're about 1.4 billion people. And we tend to think of the Indian population in a pyramid that has three slices. So there's about 300 million people at the top who everybody is going after to serve their needs. There's about 500 million people at the bottom that are very close, catastrophically, or below the poverty line, and they really are eligible for government programs and schemes as they should be. But there's a huge population in the middle called the missing middle in India. This is about 500 million people. They are too rich to be poor and too poor to be rich. And this is a huge population. They are largely uninsured. They pay for health, housing, education out of pocket. And as we have found recently, this population is beginning to bear a disproportionately high burden of health conditions within their families. There aren't too many people that are looking to serve the needs of this population, but we believe this is a huge population that is aspirational. It constitutes India's emerging middle class. These people in the next 10 years, 20 years, their children will really be the foundation of India's aspirations and growth. And hence it is really important to support this population with the right health and financial resilience products. Imagine a young woman who's 30 years of age living in a small tier 2, tier 3 town. Let's call her Anita, so we can think about Anita. She has a smartphone, so she has access to phone. But Anita is beginning to have symptoms of hypothyroidism. We talk to her with our creative content team. We create content around symptoms of hypothyroidism, what she should be watching out for. She sees this content. We then invite her to take a self-diagnostic assessment to understand if she could be at risk of hypothyroidism. She takes that. We use that content to help guide her. If she is moderate or high risk for hypothyroidism, we connect her to a telehealth partner that can provide her those services. If the telehealth partner can finish providing those services online, that's great. Otherwise, we then connect Anita to a partner secondary or tertiary care certified center in the geography of her location. So we are really holding on to the hands of these consumers, helping them walk through this journey. Given all the uncertainty around the world, it takes a lot of courage to think about the next 25 years. Hopefully in 25 years, we don't need to go to Anita to educate her. She comes to us and starts demanding what she now knows she needs for building a better life for her family. That's our vision, that's our dream, and that's our hope.